Hi HLST 152 students, this is Yvonne and this is the first screencast for this asynchronous lecture related to national health expenditures, levels of care, and primary health care and primary care. So there will be several screencasts, maximum 15 minutes each. We're going to start with the first screencast on national health expenditures, and then I think we're going to move into that part 3, and then we'll do levels of care lastly. So I just kind of changed that. I think it'll make more sense. Okay, so let's look at the learning outcomes for this lecture. So following this lecture, the student will be able to Number 1, summarize national health expenditure trends, including the impact COVID-19 has had on health spending. Then we're going to go to the 3rd, 4th, and 5th learning outcomes that are associated with primary health care and primary care, and differentiate between what those mean and what those are all about. And then lastly, we'll have a short screencast on settings of healthcare and 5 levels of healthcare. All right, so let's go on to achieve the first learning outcome. And it would be helpful then for you to go online and search for this document, National Health Expenditure Trends 2021, a snapshot. And it is, the source is from the Canadian Institute of Health Information. And again, it's not a long document, but it's some very interesting facts on what has happened to national or Canadian health expenditures due to COVID and the pandemic. So prior to the pandemic, from 2015 to 2019, there had been growth in health spending, and that averaged a certain percentage of per year. And then due to the pandemic, response funding increased. And so when we look at this document, you'll find that, again, the first statement there, 4% per year was the growth in health spending that averaged before the pandemic. And then in Canada, that rose to 12.8%. Okay. So pandemic funding was associated with scaling up of the health system capacity. There was funding that was associated with testing that was done, with vaccination, and funding that was allocated to prevent further spread of the virus, so to contain the spread of the virus. And that was related to travel restrictions, lockdowns, closure of non-essential businesses. So all of these measures, again, these particularly the ones related to containing the spread of the virus, they really had a negative effect on the economy and resulted actually in a 4.6 drop in Canada's GDP growth rate. So gross domestic product. So let's look at the 3 largest health spending categories. So this has been kind of constant for quite a while, where most of our dollars go. So there's 3 categories. So there's an image on your left refers to physicians. The one in the middle refers to, of course, hospitals. And then the one in your far right is related to drugs. All right, so these are the 3 largest categories. And if you could match the percentages with those images. So how do those line up? What percentage goes to physicians, which percentage is spent on hospitals, and which of the percentages below is related to drugs? All right, so there we have the arrows going in the right direction there. So hospitals 25%, drugs 14%, and physicians 13%. And these are expected to continue to account for the largest shares of health dollars. All right, so over 50% of total health spending is going to these three major categories. As a result of COVID, a new category of health spending arose, and that is called the COVID-19 response funding, and it makes up 7% of total health spending. And this includes federal, direct, and provincial territorial government sector spending. So, of course, the pandemic, the COVID-19 response funding includes several broad areas such as treatment costs, testing and contact tracing, vaccination, the cost of medical goods, and other related expenses. So government at all levels want to find ways to reduce healthcare costs while still providing high quality healthcare. So again, we've always had that goal, but now we can see that this is even more of a concern, all right, because of all the healthcare costs that came up as a result of the pandemic. So how can our healthcare costs be reduced while still providing high quality healthcare? So sometimes these strategies are related to upstream strategies. So we need to focus on upstream strategies with long-term cost savings. So this could include things like disease prevention, health promotion, early diagnosis, prompt intervention. These are some of the most effective approaches to achieve this goal of, again, still providing high quality health care. We also, of course, need to look at those social determinants of health, directly and indirectly, because these affect the health of Canadians. It also affects the economy and the healthcare system in terms of resource utilization and expenditures. So addressing social determinants of health is important for improving health and reducing long-term disparities in health and healthcare. All right, so that ends this screencast, and then we're going to continue looking at primary care and primary health care. Again, this is one strategy that can be used to look at reducing healthcare costs, but still providing high quality healthcare.